At some point in your life, you're going to deal with neck pain. It's been shown that over a quarter of the American adults at some point in their life are going to deal with neck pain. And it can come in many shapes, forms, and sizes with a lot of different factors that may influence or bring it on for you individually. In this video, we're going to unpack everything neck related. We're going to go through the anatomy of the neck. We'll discuss common causes of neck pain and what those associated symptoms may look at. Then we're also going to look at what can we do if we have neck pain? And that's going to look different for everybody, but there's going to be some common themes throughout your rehab and home exercise program that you can incorporate into your daily routine to help minimize the potential of dealing with neck pain or even help resolve it if you do deal with it. In order to best understand the different causes and symptoms associated with neck pain, we need to understand all of the different parts and pieces of the actual structure of the neck. In this video, we're going to dive into the bones, the ligaments which hold the bones together, discs, nerves, and the associated musculature around the neck. Now, we could talk for days at length about all of those different individual pieces, so we'll give kind of a superficial overview just for familiarity today. When we look at the bones, you're going to hear these commonly referred to as the cervical vertebrae. We have 7 cervical vertebrae, and they start at the base of the skull and run down till you get to the top of the shoulders, where the neck and the shoulder meet. On the vertebrae, you're going to see different bony prominences or projections coming out. These serve as attachment sites for either muscles, ligaments, or tendons. One very easy bone to palpate is the spinous process, and if you run your finger down the back of your neck and the back of your back, you'll feel these little bony bumps going down the center. The ligaments are there to help with stability, and there's a variety of different ligaments that connect each vertebrae to one another, but their main role is to help with stability and structure to make sure that we have a very sound foundation for movement and to perform our daily activities. Now, in between each one of these vertebrae, we have something called a disc. This disc is a fluid-filled structure that almost functions like a pillow or a shock absorber in between the different bones. And they're there for a variety of reasons. One, being for that cushion or that shock absorption. 2, to allow space in between the bones. So when we do different things like look down, up, side to side, or side bend, we have space for those bones to move and they're not rubbing on one another, causing excessive friction or irritation. As those discs start to deteriorate over time, which is a normal process involved with aging, that space starts to get smaller and we do get a little bit more friction between the bones as they contact one another. This is what's commonly referred to as arthritis, which can be a cause of discomfort, pain, or loss of movement for some individuals as they become more active or just as they progress through normal age-related changes. Now, if you look at the yellow portion on the screen, you're going to see the nerves depicted here. And we have one large nerve called our spinal cord that runs right through the vertebral column, running from top to bottom the entire length of the spine. This is basically the center of all of our nervous system. Off of the spinal cord, you're going to see nerve roots come out of the side. And these nerve roots come out at every level of the spine, and they go on to branch off to the right and the left side of our body to provide sensation and function to all of our different areas of our muscles and body so that we can feel and move appropriately throughout the day. And finally, we have a variety of different muscles that make up the neck. Some of these muscles are very small and very deep. In order to actually see them, you would have to remove the skin, you would have to slide over some of the larger muscles off to the side, then you could get that inside look at where these deeper muscles are. These smaller muscles are ones that we don't think about using. They should just happen subconsciously as we're doing activity, and their main role is to help provide stability as we do some of our larger motions that we can see, such as looking up and down, side to side, and rotating. As we get more superficial, or as we work out from the inside, we start to get involved with the larger muscles of the neck that produce movement. These are also the muscles that you tend to be able to see when you're just looking at somebody or when you look at yourself in the mirror. Muscles that you're going to notice here is your sternocleidomastoid. And if you turn your head to the side, it's the more prominent muscle that sticks out in the neck. Another muscle that you'll commonly see is your upper trapezius muscle. When somebody comes up behind you and they start massaging your shoulders or rubbing your neck, this is typically the muscle that they're grabbing. And this is a very important muscle because one of its main functions is just to hold our head up against gravity all day long. So it's a muscle that commonly gets irritated, it commonly gets fatigued, and it often gets tight. Other muscles that you hear referenced are our scalene muscles. And these muscles run from the neck down to the ribs. They help with not only movement of the neck, but also expansion of the rib cage. This is important because as we do more strenuous tasks, these muscles help us take larger, deeper breaths in to get more oxygen to our lungs so that we can do these more strenuous tasks. They tend to get irritated when we are stressed out for long periods of time or when we're doing excessive, highly intense tasks and we don't allow our body time to recover or do the appropriate self-care techniques. Another large group of muscles that we should be familiar with are your cervical paraspinal muscles. Now this is actually a group of 3 different muscles that you'll see, but they all get lumped together as either your erector spinae or your paraspinal muscles, and these run along the back of the neck. Their main job is to help hold your head up and to look upwards or extend the neck. They're another muscle group that works all day long against gravity just to keep our head upright as we sit, stand, and go through our normal day-to-day tasks. On the front side of your neck, you'll find your deep cervical flexor muscles. These muscles are deeper into the neck and they provide a role with anterior or stability on the front side of the neck. Their main job is to bring the head down to the front, but they also help keep a role with our head not pushing too far forward. So you may hear people having referred to as a forward head posture. We're starting to hear it now as text to neck, where people have their head too far forward because they're looking down at their phone or they're looking down at their computer. With the deep cervical flexors, there's a wide variety of muscles that fall into this category, but their large role is to do the opposite of what our cervical extensors do, help provide balance to the neck from a postural standpoint, from a stability standpoint, and from a quality of movement standpoint. There are many different causes or different factors that can influence neck pain, and also the quality or the type of neck pain that you're dealing with. For some people, it may present as stiffness or loss of range of motion. For others, it may be very painful. And even if it is painful, that pain can come in a variety of shapes and forms. For some, it may be dull and achy. For others, it can be a sharp or stabbing sensation. It can be present all day long, or it can come and go based off activity or position. In regards to location, it could be localized to one spot on the neck or the top of the shoulder, or it could radiate and travel down the arm into the hands and fingers. Some of the different things that are going to influence what you're feeling is what structure is actually involved. So we talked about bones, ligaments, muscles, discs, nerves. All of those different structures tend to have a different location and quality of symptom associated with them. Oftentimes when we talk about discs and nerves, those can be ones that provide not only discomfort locally at the site, but also traveling into the upper extremity. Oftentimes if it's a more bony related injury, you'll tend to have issues right around where that bone is located. And if it's more muscular in nature, it tends to be consistent with wherever that muscle starts and stops, and located either at one of the ends of the muscle or within the belly or the mid portion of that muscle. Things that can contribute to the presence of pain can be repetitive tasks or motions that you do. So if for work or during your daily activities, you have to do the same thing over and over and over, or put your body into a specific position for a long period of time, you can put excessive stress or strain on different structures of the neck. It can also be due to things such as impact or trauma. So we often associate a very high force impact like a car accident where somebody can get a whiplash type mechanism, or maybe there's direct force to the head or neck area, such as what happens in a sporting event or something where there's expected impact and contact to happen. It can also be due to doing something unexpected or moving very quickly. So maybe you go to reach for something, maybe you go to turn your head really quick, and you can have pain in that standpoint. Another common thing is that you can have certain anatomical predispositions, and this is where we start getting into posture-related pain. And there's not really an ideal posture that we should have, but if we're doing something for an excessively long period of time, or we tend to get into and out of the same position with a lot of repetition, we can start to wear down some of those structures or just put extra strain on them. And a variety of different ways that neck pain can present if you do have it. Let's start to go into what we can actually do if we are experiencing neck pain. And before you get into this next section of the video, I want to encourage you, if you are dealing with neck pain, seek out a healthcare provider. Find a physical therapist, find a physician, find a qualified healthcare professional to allow you to triage the situation, figure out what's the most appropriate plan of care for you. These next exercises, I don't want you to think as being the cure or the answer for every and all neck pain, but I want to provide you with some different examples of different categories of activities that you will find as part of a rehab program for neck pain. We're going to talk about mobility, we're going to talk about strength and stability, and we'll discuss some simple self-care strategies. These tend to be the three pieces that make up any rehab program, but how much you factor in each piece and how heavily you favor each piece is going to be dependent on your individual case. The actual exercises or interventions that you'll select within each one of those categories will vary from person to person as well, but hopefully this can serve as a reference for some things that might pop up in a rehab program. Mobility plays a large role in managing neck-related issues. And when we talk about mobility, we're not just thinking about the head and neck itself, but how the shoulders, the trunk, and all of that works together. So one of my favorite things to do with neck pain is find exercises where we're getting not only the neck moving, but the adjacent body parts to it as well. This helps a lot of times for people who are fearful or apprehensive with movement, because you're allowing them to use parts of their body that are not actively injured. Their arms, their shoulder, their chest, their back. The neck becomes a piece of the puzzle as opposed to the whole point. So the three things that I like to do are a cat-cow, a reach through, and some people call this a thread the needle, and a side-lying rotation. For the cat-cow, you'll have them on all fours with their hands under their shoulders, knees under their hips, and then from here they're going to round their back up, look down towards their belly button, then go the opposite direction, arch the back, and look up towards the wall in front of them. With this, it should be a slow and controlled motion, and you can do anywhere between a set of 5 to 10, and I usually encourage people just to operate within a range of motion that feels comfortable to them. From here, we can go one step further and we can add a little bit of rotation to go along with flexion or bending forward. And with this, we're going to take a hand and we're going to reach through, bringing our ear towards the ground, and then come back up. With this, encourage them to follow their hand with their eyes, and that way we get some head and neck motion as well as upper back and shoulder. And the third and final stretch is a side-lying rotation, some people refer to as an open book, where we're on our side, our knees are bent, our legs are stacked, arms are out in front, and then we're going to bring this top arm up and over as we follow the hand with our eyes, get shoulders to contact the ground, and then come back to a starting position. With this, we can do 5, and then switch and do the same thing on the other side. If you need to, you can place a pillow or a towel or something underneath the head and neck to support that area if they're dealing with some discomfort throughout the motion. Now, in addition to mobility, we also need stability and strength of the neck and upper back area to be able to tolerate all of the different tasks that we do as part of our activities of daily living, our occupation, and for our leisure and recreation. Now, there are some specific activities that you can do to strengthen the muscles of the neck, but you typically want some guidance either from your PT or whoever your healthcare provider is to make sure that they're safe and appropriate to do. These next two exercises, though, are going to involve strengthening the upper back and also our entire core. So not only the neck, but our trunk. And these are ones that are often tolerated well by individuals because, again, the neck is not the only piece of the puzzle. It's one of many different areas that are working. Our strength of our upper back and our shoulders also helps to support the neck. So the first exercise that we're going to do is going to be one where we lie on our stomach. And I'm going to have my forehead on the towel, my arms are going to be out in a T position, and I'm going to elevate my hands off of the ground. With this, it's going to strengthen the muscles of the upper back and shoulders in between the shoulder blades. So with this, we'll be on the ground, we'll have our head on the towel, arms out to the side, lift up, hold for 3, and then come back down. With that activity, you should feel the muscles of the upper back, in between the shoulder blades engage. You may feel the backs of the arms a little bit as well, but we should be able to keep our neck relaxed. It shouldn't feel like we are straining our neck to carry out that task. Now, the next one that we'll do is going to be a high plank, or the top position of a push-up. And for some individuals, just holding this may be challenging. So you can start by holding for 10 or 15 seconds, progressing up to 30. But if that's easy, I'm going to show you 2 different variations that you can do to make it a little bit more challenging. We're going to have our head looking straight down at the ground. We're not going to cock the head up. If this is too easy, we can practice alternating, lifting a foot off of the ground. As we lift the foot, we want to try to keep our back flat and not let our hips rotate. Another variation is we can bring the feet a little wider, and we can alternate tapping our opposite shoulder with our opposite hand. Again, trying not to let the back rotate and trying to keep our shoulders square to the ground. Both of those are going to involve the entire core from a core stability standpoint. And if you find that too challenging, you can do it from an elevated surface with a steady object such as a countertop, a table, or even an adjustable bench in the weight room. So the last thing that we'll talk about will be more of the self-care bucket of activities that we can do. And there's 2 simple things that I like to teach individuals so that they can take a little bit more active ownership over managing these flare-ups when they have them. And the first one is using a tennis ball or a lacrosse ball to do a simple massage to some of the muscles of the upper back at the lower part of the neck. When these muscles get tense and when they get tight, they can create some symptoms either locally at the neck or even up into the head and cause some headaches. So with this, a simple way to help combat that is taking a ball, placing it on the upper part of the back, and if you find your shoulder blade, go just inside of that, and then pin the ball between your back and the wall. I like to take the hands and cross them across the front, and that helps open up the back. And then you can do gentle rolls up and down or side to side. You do not need to use a lot of pressure for this. And what you're looking for are different areas where the tennis ball is rolling over that feel a little bit different than the surrounding areas. So they may be a little bit more sensitive, they may be a little bit more sore, and you can put some light pressure onto those muscles. Muscles respond well to stretch, they also respond well to pressure, and pressure is one way that you can help get them to relax. With that, you don't need to spend any more than 30 to 60 seconds in a given area doing that. Another simple thing that you can do throughout the day, and I love this for people who spend a lot of time sitting at a desk, is taking a towel, and it can be a short towel like this, or it can be a longer bath towel, but you're gonna put it behind the neck at the top of the shoulders, and you're gonna pull down on the towel. And with this, it doesn't need to be a lot of pressure, it just needs to be enough to help take all the slack out of the towel and give a nice sturdy base for you to then move your neck. And with this, we're gonna put a little pressure down with the towel, and we're gonna look up towards the ceiling. With this, you can do 10 movements up towards the ceiling as you keep that constant pressure with the towel. For people who find themselves spending a lot of time looking down throughout the day because you're reading or typing on a keyboard or using your phone, this is a great exercise to help loosen up the neck and get it moving in the opposite direction. Hopefully at this point, you've learned a little bit about neck pain, the anatomy of the neck, what can cause and contribute to neck pain, what neck pain can present like, and how we can go about managing neck pain should we have any in the future. If you like this video, please share, like, and subscribe, and stay tuned next month for when we tackle the elbow.